So for this month's blog, I'm going to be talking to you about something that we hear a lot when patients come in. They come in, they complain about a sharp pain that they're feeling in their muscles, somewhere in their back, maybe in their arms, or even down the legs. And they have either been told or looked up on Google and thought that they had a pinched nerve. So what I want to do is just discuss, well, what exactly is a pinched nerve? To give a little background about what we do here at Integrated Health Solutions is that we specialize in musculoskeletal disorders. We have to understand that every case is unique and that every patient is going to be coming in with slightly different symptoms and complaints. And it's our job to really understand how those complaints correlate to the underlying dysfunction, not just the symptoms of pain. Now, for something like a pinched nerve, what we're really talking about is something called peripheral neuropathy or peripheral nerve entrapment. Now, let's just start off by defining that. So I have a spine here. Right here, all these little yellow guys, these are the nerve roots. These are the nerve roots that pop out of the spinal cord itself that then branch out into different areas of the spine. When we're talking about a peripheral nerve entrapment, we're talking about any compression or congestion around these nerves out here, just not involving the spinal cord or the roots itself. These are nerves that can be impinged upon really just about anywhere, but there are a few hot spots, and some of the ones that we hear about a lot are either in the carpal tunnel. There's ones going around the elbow, definitely in the shoulder for the upper extremity, in the lower extremity, somewhere around the hip. You hear about hip impingements, hip pointers, things like that, going down into the knees and definitely into the feet as well. There's, as I mentioned before, a lot of different symptoms that can occur with these types of issues. Most commonly, it is a sharp or burning pain. That's usually because the nerve is become inflamed around the area where that congestion or that compression is occurring. There's also sometimes decreased sensation, or even numbness to the area. We often see this with the hands or with the feet. And it almost feels like they can be falling asleep or sometimes even feel weak. And that's just understanding that the diminished conversation between the brain and the muscles via the nerves is actually being affected in that situation. As far as causes are concerned, there's a bunch that can be definitely related to a traumatic event, but in the absence of something like a sprain, strain, or even a fracture, typically what we're looking at is repetitive actions. Now, if it's sport related, you think of your tennis player hitting over and over and over, and if they're over rotating, potentially we're getting into an issue with this pronator muscle right here, known as your pronator teres. With other people, it could be repetitive actions at their desk, and that's something that we definitely see a lot, especially if they're not practicing perfect posture. So if we're not getting in a position where we're keeping our ear on top of our shoulder, on top of our hip, we're rounding that spine forward, we're rotating those shoulders inward, well, that's just not the ideal posture, and it's making harder for the structures, namely the nerves, to flow out into the periphery, and therefore makes them more likely to become impinged or entrapped, the pinched nerve. That's the one thing that I want to really kind of discuss today. And you can read it more in the blog, but there is a case of a woman that came in and into our office. She had two failed attempts to resolve carpal tunnel, or what she thought was carpal tunnel, surgically, as well as doing, I believe it was months of physical therapy. Again, it was all predicated on this right here, your carpal tunnel. It's where the median nerve comes out here and then refers information to the hand. Through some testing and thorough history taken, we actually found out that her issue was in that pronator muscle, which is all the way down here. So while everyone previously had been focused on area right here, the true underlying cause was actually further up the arm. And by really addressing the underlying issue and not just following the symptoms that she was having in her hand, we're actually able to resolve the case in a very relatively short period of time. And there's cases like that we see all the time, especially, like I said, in the extremities, both arms and legs. And just by taking the right approach, we can really have a positive effect on this. So enjoy reading the blog. I hope it just speaks to a couple of you that either know someone or you yourself could benefit from some of the things that we offer here. Thanks for listening.